68-year-old woman presents with recurrent episodes of fecal incontinence over the past 6 months. She also reports urinary incontinence, occasional diarrhea, central obesity. She denies neurologic symptoms. Which of the following risk factors has the strongest association with fecal incontinence in this patient? A, older age. B, diarrhea. C, urinary incontinence. D, central obesity. And E, female sex. And the correct answer, drum roll, is C, urinary incontinence. Urinary incontinence is strongly associated with fecal incontinence, suggesting a shared underlying dysfunction in pelvic floor muscles or neural control. So, what's the strongest link with fecal incontinence is urinary incontinence, because they are all happening around the same area, right? Older age is a risk factor, but does not specifically explain this patient's symptoms. And diarrhea can worsen fecal incontinence, but is not the strongest independent risk factor. So please, I need you to write this in your notebook. The strongest independent risk factor for fecal incontinence is urinary incontinence. That's the strongest. Let me say that again. The strongest independent risk factor for fecal incontinence is urinary incontinence. Now, what about central obesity? That's D. It contributes to increased abdominal pressure, but does not directly affect on fecal incontinence, and it is less significant. And female sex, we learned that causes or is a risk factor for fecal incontinence similar to male sex. So it does not happen that females have a higher risk of fecal incontinence as compared to males. Is the same. The number one independent risk factor for fecal incontinence is urinary incontinence. Why? Because they all share a similar underlying cause, right?